More and more people say they're having trouble paying for prescription drugs and health care. Some telling WREG investigators it's costing more than their mortgage, even with insurance. Our chief investigator, Jessica Gertler, digs deeper into the growing problem and how one pharmacy is working to help customers cut costs.
I had to quit work in 2015. I started having symptoms, well, I had symptoms even as a child.
Symptoms that got worse for Penny Colasar.
I have lupus, I have rheumatoid arthritis, and I have psoriasis.
It's changed her life.
When you go into what they call a flare-up, it's horrendous. It's horrible. It's painful. You have brain fog.
If that's not enough, Colasar says the medications weren't working.
It took us a good 2 years to find the right combination of which medications that I needed to take.
The problems kept piling. While insured, the medications still cost a lot.
My cost with insurance was $369.
Then, when her husband retired, prices went up even more under Medicare.
Our biggest expenses are our mortgage and health care, and a lot of that is prescription. And I have to say, we spend more on the second than we do the first.
She's not alone. As basic expenses like groceries and gas have increased, so have prescription drug prices. The Department of Health and Human Services reports over the last year, prices rose an average of 31%, with some increasing 500%.
Healthcare costs are rising faster than incomes.
Sarah Collins is the vice president for coverage and access at the Commonwealth Fund, a health research nonprofit.
Just have more copays, higher deductibles, and it just feels like every time you go to the doctor, it just seems more expensive.
Collins says their survey shows 43% of working age adults last year were underinsured, meaning they were inadequately covered by either their employer's insurance or through coverage purchased through the individual market and marketplaces. 42% say they couldn't pay their medical bills or were trying to pay off medical debt. What's even more unnerving, 46% say they skipped or delayed medical care because of cost. The CDC says 1 in 10 Americans skipped doses of their medication to save money.
What's the impact for a city like us?
What it means is that people are avoiding treating health problems, so that contributes to poor health over time. It means that there's less the workforce productivity.
And over time, Collins says we'll see a greater strain on our healthcare system because people will leave their chronic health problems untreated.
The United States has a very complex, fragmented healthcare system. Very.
Michelle Zulu used to work for a large pharmacy chain.
I found, in a way, I was participating in the doing harm because when I had to turn you away because you couldn't afford your medication, knowingly you needed it, that did a number on me.
3 years ago, she began working for Good Shepherd, a nonprofit membership-based pharmacy in Memphis, working to get those who are uninsured or underinsured their prescriptions they need for free or at cost.
People having to decide, do they eat today or do they not?
In a city where 22% live in poverty, every dollar matters.
I do think we have a lot of health disparities in Memphis.
While they have many uninsured clients, Zulu says they're seeing more underinsured people. She says they've been able to help them save on average 60 to 90%.
Our city is very blue collar. So with that being said, I do think there is a lot of people that fall into the gap of being covered, but are they really?
We have to get the word out more. I mean, we just do. Things like this are amazing because this is a resource available in our city.
Colasar says without Good Shepherd, she wouldn't be able to afford her medications, totaling hundreds, if not $1,000 a month.
I would probably be bedridden.
The thought painful, and to think of the others also suffering.
We don't fall below the poverty level in this city. I have no idea what the people who can't afford insulin and these types of medications that they cannot live without, I don't know what they do.
Jessica Gertler, WREG News Channel 3.
Big challenge for a lot of people. And to find out more about Good Shepherd's membership program, go to WREG.com and click on this story. We have also put more information about their program Remedy Chain and how they changed the state law so you can donate some medications to those without insurance.